I'm Dr. Jennifer Zame. Today I'm going to provide you with some information about diabetic peripheral neuropathy. One of the most common complications of diabetes is diabetic peripheral neuropathy, a condition that can damage the nerves in your hands, legs, and feet, leaving you unable to feel pain or temperature changes. In fact, over 60% of all people with diabetes will eventually develop this condition. Peripheral neuropathy can have very serious consequences. Imagine developing a blister on the bottom of your foot, but it goes unnoticed because you don't feel it. If the blister becomes infected, this can eventually lead to foot amputation. Although there's no known cure for peripheral neuropathy, the good news is there are treatments that can help you slow the progression of this condition and limit the damage to your hands, legs, and feet. It's important to pay attention to the warning signs of this condition. The changes can be barely noticed. Many people tend to mistake the symptoms of nerve damage as a sign of aging. Ignoring the signs could allow the condition to worsen over time. First, let's look at causes of peripheral neuropathy. If you're diabetic, high blood sugar levels can cause nerve damage to your extremities as well as other parts of your body. Nerves are responsible for transmitting signals such as sensation, movement, circulation throughout your body. Once the nerves are damaged, your brain may not deliver these important messages to your body. Depending on the affected nerves, symptoms of diabetic neuropathy can range from pain, redness, and numbness in your extremities to problem with your digestive system, urinary tract, blood vessels, and heart. Neuropathy in a diabetic patient starts in the motor, autonomic, and sensory components of the nervous system. With motor components, the signal going to the muscles are interrupted, which cause problems with movements of the muscles and alignment of the bones. Autonomic components include problems with the heart, blood vessels, and sweat glands. For example, the sweat and oil glands may not function properly, which could lead to serious skin dryness and hair loss. Sensory components prevent you from feeling the difference between hot and cold, sharp or dull, or you're simply unable to feel any injuries in the hands, legs, and feet. So, what are the signs and symptoms of peripheral neuropathy? Your feet and legs are often affected first, followed by your hands and arms. Signs and symptoms are often worse at night and may include numbness or reduced ability to feel pain or temperature changes, tingling or burning sensation, sharp pains or cramps, increased sensitivity to touch. For some people, even the weight of a bed sheet can be very painful. Muscle weakness, loss of reflexes, especially in the ankle, loss of balance and coordination, ulcers, deformities, local swelling, and warmth. Watch for these changes. Touch sensitivity. You may experience sharp pain or sensitivity to touch or tingling or numbness in your toes, legs, or hands. Muscle weakness. You may have difficulty walking or getting off from a chair. You may have difficulty grabbing things or carrying things with your hands. Balance problems. You may feel more unsteady than usual or clumsy when you walk. Watch for changes in the size and shape of your feet. To treat nerve damage associated with diabetic peripheral neuropathy, you need to keep your blood sugar levels in your target range and protect your feet. If you don't know your target range, please talk to your doctor. Keeping your blood sugar levels within your target range is one of the best ways to help prevent neuropathy and other complications of diabetes. Controlling your levels may require daily monitoring, especially if you take insulin and frequent doses of other diabetic medications. Consistency is important because changes in blood sugar levels can accelerate nerve damage. You can keep your blood sugar levels under control through a combination of diet, exercise, and medication. Medication to relieve pain, reduce burning, numbness, tinglings are available. Talk to your doctor about the best treatment plan for you. Foot care is absolutely necessary. It is recommended that you have a complete foot exam at least once a year. If you already have foot problems, have your feet checked at every visit to your doctor. A complete foot exam includes checking the skin, muscles, nerves, and blood flow. Your provider would also check for numbness in your feet by touching your foot with a monofilament. It looks like a stiff piece of nylon fishing line or bristle in a hairbrush. Another way to check for nerve damage is using a tuning fork. It may be used to touch your foot or hand to see if you can feel it moving. If the doctor thinks you might have nerve damage, your doctor may recommend more tests. As a diabetic, you should know how to take care of your feet at home. Check your feet from top to bottom daily. Look for cuts, sores, abrasions, ulcers, fungus, dryness, and redness. Any changes should be reported to your doctor. Wear proper shoes, do not walk barefoot, and dry your feet thoroughly after bathing, especially between the toes. Always use lotion to moisturize the skin, but never in between your toes. Low-impact exercises are useful and well tolerated by many people with diabetes. Exercise can improve circulation, balance, and lower your blood sugar. But first, discuss the best exercise program for you with your doctor. Use these tips to help you slow the progression of diabetic neuropathy and limit possible damages to your hands, legs, and feet. With proper care and monitoring, it is possible to manage your condition.